Did you know that pancreatic cancer now claims more lives each year than breast cancer, yet it gets far less attention? The reason? It's called the silent killer for a reason. By the time most people notice something is wrong, it's already advanced, and options are limited. But here's the thing, many warning signs appear months before diagnosis. They're subtle, easy to miss, and often brushed off as just gas, aging, or stress. That's why today's video is so important. Because what if you could recognize the danger earlier? New research from Johns Hopkins shows that simply spotting 3 key symptoms could increase your chance of early detection by up to 68%. So if you're over 50, or you care for someone who is, you need to hear this. These 9 signs could help you catch pancreatic cancer early, and maybe even save a life. Number 1, dark yellow or brown urine. Let's start with a symptom that might seem small, but could carry a big warning: dark yellow or brown urine. Most of us don't give much thought to the color of our urine. We usually assume it's just dehydration or maybe something we ate. But what if I told you that this everyday detail could be one of the first signs of pancreatic cancer? Here's what's happening behind the scenes. Your pancreas lies deep in your abdomen, quietly doing important work like producing digestive enzymes and regulating blood sugar. But it also shares space with another important structure, your bile duct. This duct carries bile, a greenish-yellow fluid produced in your liver, down into your intestines to help digest fats. When everything's working normally, bilirubin, the yellow compound in bile, passes into your stool and gives it that familiar brown color. But if a tumor starts growing in or near the head of the pancreas, it can press against the bile duct and slowly block it. This causes bile to back up into the bloodstream instead of flowing into the intestines. And when that happens, your body looks for another way to get rid of the excess bilirubin. One of the first alternate exits? Your urine. So, even if you're drinking enough water and staying hydrated, your urine may turn a dark yellow, brown, or even tea-colored shade, something that's often mistaken for just not enough fluids. But this is different. It's darker than usual, more persistent, and doesn't clear up with more water. Think of the color of cola or strong iced tea, that's your red flag. And here's something crucial: this change in urine color can actually appear before any yellowing of the skin or eyes. That means it might be the earliest external symptom of a serious internal issue, long before full-blown jaundice sets in. Unfortunately, because it's such an easy symptom to dismiss, many people don't realize what's happening until the cancer is more advanced. If you notice your urine is unusually dark for more than a day or two, even when you're well hydrated, don't ignore it. Especially if you're over 50, this could be your body trying to tell you something important. It doesn't mean you have pancreatic cancer, but it does mean it's time to check in with your doctor. A simple blood test or imaging scan could help catch a potential issue early, when treatment options are more effective. So don't overlook this small but significant sign. In some cases, that quiet clue from your bathroom visit could be the first step to saving your life. Number 2, upper abdominal pain or back pain. Now let's talk about a symptom that many people, especially seniors, tend to brush off as something minor or unrelated: upper abdominal pain or discomfort in the mid-back. You might think it's just gas, indigestion, or maybe even a pulled muscle. But persistent pain in these areas can actually be a key early sign of pancreatic cancer, particularly when the tumor develops in the body or tail of the pancreas. This type of pain is often described in very specific ways. People report a dull, gnawing ache deep in the upper part of the abdomen, just under the rib cage. It's not the sharp, stabbing pain you might associate with something like appendicitis or gallstones. Instead, it's more like a constant pressure or tight, band-like sensation that may even wrap around your side or radiate straight into your back. That's because the pancreas sits close to several nerve clusters, and when a tumor starts to grow, it can press against those nerves and surrounding structures, sending pain signals to both the front and back of your body. One of the hallmark features of pancreatic cancer-related pain is how it behaves. You may notice it worsens after meals, especially heavier ones, or when you're lying down flat. Some people find that sitting slightly forward or curling up can ease the discomfort a little, which is not typical for routine indigestion. In the early stages, this pain might come and go, which makes it even easier to ignore. But over time, it often becomes more persistent and harder to manage. Now, here's where it gets tricky. Older adults frequently experience back pain, and it's easy to assume it's from arthritis, posture, or even a worn-out mattress. Similarly, upper abdominal pain might be blamed on acid reflux, gas, or stress. But if the pain doesn't go away, or if it gets worse after eating, wakes you up at night, or feels deeper than usual, it's worth taking seriously. Doctors often recommend abdominal imaging, like an ultrasound, CT scan, or MRI, if this type of discomfort is unexplained and persistent. Why? Because pain in the upper abdomen or middle back, especially when paired with other symptoms like dark urine, weight loss, or fatigue, could be your body signaling a deeper issue, one that's not just muscular or digestive. If you're feeling this kind of dull, persistent upper abdominal or mid-back pain, and it sticks around for more than a few days, or comes back repeatedly, don't ignore it. Especially if it doesn't improve with antacids or over-the-counter pain relievers, that's your cue to get it checked out. In many cases, early detection starts with recognizing what doesn't feel normal anymore. Remember, not all pain is harmless, and this one could be your body's early warning sign. Number 3, feeling full too quickly, early satiety. Here's a symptom that's surprisingly easy to overlook: feeling full too quickly when you eat, also known as early satiety. It might not sound serious at first. After all, most of us have had moments where we've felt full faster than usual, maybe after eating too fast, when we're stressed, or following a big holiday meal. But when this feeling starts to happen regularly, especially when you're only eating small portions, it could point to something much deeper going on inside your body, like pancreatic cancer. So, what causes this sensation? When a tumor starts to grow in or near the pancreas, it can press against the stomach or small intestine, reducing the amount of space your stomach has to expand. Think of it like someone squeezing one end of a balloon. You can only blow in so much air before the pressure becomes too much. The same thing happens with food. Your body starts signaling that it's full, even when you've barely eaten a few bites. This early feeling of fullness can also be accompanied by bloating, tightness in the abdomen, or even mild nausea, especially after meals. You might notice that you're eating far less than usual and still feeling overstuffed, like you've eaten an entire meal when you've only had a few spoonfuls. What's tricky is that this symptom can come on gradually, and it's easy to chalk it up to common digestive changes that happen as we age. In fact, many seniors dismiss early satiety as a normal part of getting older or attribute it to acid reflux, indigestion, or even stress. But when that bloated or overly full feeling sticks around for more than a few days or keeps coming back, it's time to dig deeper, literally and figuratively. Persistent early satiety could signal that something is physically blocking or putting pressure on your digestive organs. Doctors often look for this symptom in combination with others, like unexplained weight loss, fatigue, or changes in your stool, because together, they can point toward pancreatic or gastrointestinal issues. And here's the important part: when caught early, these signs can lead to faster diagnosis, better treatment options, and a greater chance of survival. So if you or a loved one begins to feel unusually full after small meals, don't shrug it off. Don't just reach for antacids or start skipping meals. Your body might be trying to send you an early warning. Let your doctor know, especially if you're over 50 or have a family history of pancreatic issues. A simple scan or blood test could give you the clarity and peace of mind you need. Remember, something as subtle as feeling full too quickly could be more than just digestion. It could be your early opportunity to take action and protect your health before the condition progresses. Number 4, fatty, pale, or greasy stools, steatorrhea. Let's move on to a symptom that many people feel too embarrassed to talk about, but it can be one of the most direct signs of trouble with your pancreas: changes in your stool, especially when it becomes fatty, pale, or greasy. Now, I know talking about bathroom habits isn't everyone's favorite topic, but this is something we shouldn't ignore, because your stool tells a story about how your body is digesting food. When things start to change noticeably, it's your body waving a red flag. So, what exactly are we looking for? If your stool begins to look lighter than normal, takes on a gray or clay-like color, floats instead of sinking, or has a shiny, oily appearance, that's what doctors refer to as steatorrhea. This kind of stool often smells worse than usual and may even be hard to flush away. Why does this happen? It all comes back to the pancreas. One of its main jobs is to produce digestive enzymes, specifically the ones that help break down fats, proteins, and carbohydrates. But when a tumor forms and either blocks the pancreatic duct or interferes with enzyme production, those enzymes can't get where they need to go. Without enough enzymes in the small intestine, your body simply can't digest fats properly. The undigested fat ends up in your stool, causing it to look greasy and pale. This is not just a cosmetic issue, it's a clear sign that your digestion isn't working correctly. And more importantly, it's a strong indicator of pancreatic dysfunction, especially when combined with other symptoms like weight loss, nausea, bloating, or early fullness after meals. The danger here is that these stool changes can come on gradually. People often think it's just something they ate or a mild stomach bug. Others might assume it's irritable bowel syndrome or lactose intolerance. But steatorrhea is different. It tends to persist over time, and no matter what you eat, the problem doesn't really go away. Now here's something crucial. If you consistently notice stools that are greasy, pale, or unusually foul-smelling, and you're experiencing other symptoms like bloating or unexplained weight loss, it's time to speak with your doctor. Ask specifically for a pancreatic function test, and possibly an imaging scan to check for blockages or tumors. Sometimes the answers lie in the smallest details, like the color and texture of your stool. And catching something like this early could make all the difference. Because while these symptoms might be uncomfortable to discuss, they could help you detect pancreatic cancer before it becomes life-threatening. So, don't be afraid to bring it up. Your doctor has heard it all before, and they'll be glad you spoke up. It might just be the first step toward getting the answers and the care you need. Number 5, unexplained weight loss and loss of appetite. Let's talk about something that often gets overlooked, or even praised at first: unexplained weight loss. Now, if you've recently dropped a few pounds and you've been trying to eat healthier or move more, that's great. But what if the weight is coming off and you're not even trying? What if your clothes are getting looser, your energy is dropping, and your appetite has just disappeared? Unintended weight loss, especially when combined with a lack of appetite, can be one of the earliest and most serious warning signs of pancreatic cancer. And here's why. First, cancer cells are incredibly demanding. They use up a lot of your body's energy, much more than healthy cells do. So even if you're eating your regular meals, your body may still be burning through calories at a faster rate than normal, without your permission. Second, as we discussed earlier, pancreatic cancer often interferes with digestion. When tumors block the pancreatic ducts or reduce enzyme production, your body struggles to absorb nutrients from food. That means even if you're eating enough, your body may not be getting the fuel it needs. Over time, this leads to malnutrition and steady weight loss, even though your eating habits haven't changed. And third, there's the issue of inflammation. Cancer triggers a low-grade inflammatory response in your body, which can suppress your appetite entirely. People often describe it as a sudden disinterest in food. Meals they once loved just don't appeal to them anymore. You might feel nauseous, skip meals more often, or take a few bites and feel done. Here's the number you need to know. If you've lost more than 5 to 10% of your body weight in 6 months, without trying, it's medically significant. For example, if you weigh 150 pounds and suddenly drop 10 to 15 pounds without any changes in your lifestyle, that's a red flag your doctor needs to know about. And it's not just the scale that tells the story. Look for other signs like muscle loss, fatigue, or your face and arms appearing thinner. Even your posture can change when you lose muscle mass. Combined with symptoms like early satiety, bloating, or digestive issues, weight loss becomes more than a nutritional concern, it becomes a potential diagnostic clue for something deeper. It's easy to brush this off, especially if friends or family say you look great or seem slimmer. But when weight loss comes without effort, and especially when paired with a sudden lack of interest in food, it deserves immediate medical attention. So if you've been losing weight and can't figure out why, or you just haven't been hungry for days or weeks, don't wait. Speak up. Get checked. Because this symptom, while often hidden in plain sight, could be the very thing that helps you catch pancreatic cancer before it advances further. Number 6. Chronic fatigue and weakness. Let's take a moment to talk about something almost everyone experiences, but often ignores: chronic fatigue and physical weakness. Feeling tired once in a while is normal. But when that tiredness doesn't go away, even after a good night's sleep, or when everyday tasks start feeling unusually difficult, it could be something more serious. In the case of pancreatic cancer, this kind of persistent fatigue is often one of the earliest yet most misunderstood signs. You might feel like you're dragging through the day, struggling to get out of bed, or needing to sit down after doing simple things like making breakfast or walking across the room. So what's going on? Cancer, including pancreatic cancer, puts your body in a constant state of stress. Cancer cells consume large amounts of your body's energy and nutrients, leaving less for your healthy cells to use. At the same time, the body responds to the tumor by releasing inflammatory chemicals, which further drain your energy reserves. It's like your body is fighting a silent war in the background, even if you don't feel sick yet. Fatigue from cancer isn't just physical either, it often comes with mental and emotional exhaustion. Many people also experience feelings of depression, anxiety, or low motivation. That makes it easy to brush off as stress, aging, or just feeling down. This type of fatigue doesn't improve with rest. You could sleep 8 to 10 hours and still wake up feeling worn out. When climbing stairs, grocery shopping, or getting dressed starts to feel like a workout, your body is telling you something isn't right. If you or a loved one is experiencing this kind of unshakable exhaustion, especially alongside other symptoms like weight loss, loss of appetite, or digestive issues, don't ignore it. It may not be just aging. It could be a systemic warning sign of something much more serious going on inside. When rest doesn't help and your strength keeps slipping, it's time to listen to your body and talk to your doctor. Early attention could make all the difference. Number 7. Blood clots, DVT, or pulmonary embolism. Now here's a symptom that often comes out of nowhere and catches people completely off guard: blood clots, especially in the legs or lungs. Most people don't realize that pancreatic cancer can make your blood more likely to clot, a condition called hypercoagulability. In fact, for some patients, a serious blood clot is the very first sign that something is wrong. Let's break this down. When a tumor forms, it can release certain inflammatory chemicals into the bloodstream. These substances can disrupt the body's normal clotting balance, making your blood more likely to form clots, even when you haven't had an injury or surgery. This can lead to deep vein thrombosis, or DVT, which typically shows up as swelling, redness, and warmth in one leg. It may feel tender to the touch, or you might notice a heaviness or throbbing sensation. Now, here's where it becomes dangerous. If a piece of that clot breaks off and travels to your lungs, it can cause a pulmonary embolism, a life-threatening condition. The warning signs of this are sudden shortness of breath, chest pain that worsens with deep breaths, a rapid heartbeat, or feeling lightheaded. In some cases, people go to the emergency room thinking they're having a heart attack, only to discover it was a blood clot, and later find out it's linked to an undiagnosed cancer, like pancreatic cancer. For seniors especially, a new or unexplained blood clot should always raise red flags. It's easy to assume it's just from sitting too long or being inactive, but if you haven't had recent surgery or an obvious cause for the clot, doctors should investigate further. If you experience an unexplained blood clot, especially in the leg or lung, ask your doctor about screening for hidden cancers, particularly pancreatic cancer. It's a precaution worth taking, because catching the disease early, sometimes through this very symptom, can make a critical difference in how it's treated. So don't wait, your body is giving you clues. And sometimes, what looks like a clot might just be the first chapter in a story that needs to be uncovered right away. Number 8. New-onset diabetes, especially without weight gain. Here's a surprising symptom that many people would never connect to pancreatic cancer: new-onset diabetes, especially in people over the age of 50. Now, diabetes is incredibly common, and in most cases, it's related to lifestyle, diet, or family history. But when it appears suddenly, without the usual risk factors, and particularly without weight gain, it may be a hidden sign of something deeper going on, like a pancreatic tumor. So, how are they connected? The pancreas plays a key role in regulating blood sugar by producing insulin, the hormone that helps your body use glucose for energy. If a tumor begins forming in the pancreas, especially in the areas where insulin is produced, it can interfere with this process. Suddenly, your blood sugar levels spike, and you may be diagnosed with type 2 diabetes, even if you've never had problems before. Many people assume it's just age catching up with them or think, I must have eaten too much sugar over the years. But if you're in your 50s, 60s, or 70s and you've recently been diagnosed with diabetes, especially if you've actually lost weight instead of gained it, it's worth digging deeper. According to recent studies from Mayo Clinic and the National Institutes of Health, 2023, a significant number of pancreatic cancer patients had been diagnosed with diabetes 1 to 3 years prior, often with no family history or typical lifestyle risks. In fact, researchers now consider sudden diabetes in older adults to be a potential early warning sign of pancreatic cancer. So, what can you do? First, don't panic. Most cases of diabetes are not linked to cancer. But if your diagnosis seems unusual, or you're also experiencing symptoms like fatigue, appetite loss, or digestive issues, ask your doctor about pancreatic screening. It could be something as simple as a blood test or an abdominal scan, but it could give you the answers you need. New-onset diabetes after 50, without the usual weight gain or risk factors, deserves attention. It might not just be diabetes. It could be your body's way of sounding the alarm before something more serious develops. Number 9. Ongoing digestive problems, nausea, vomiting, discomfort. Let's talk about a symptom that many people live with for weeks, or even months, before realizing something might be seriously wrong: ongoing digestive problems. We all get an upset stomach now and then. Maybe from a heavy meal, a bug going around, or something that just didn't sit right. But when that discomfort becomes chronic, and nothing you try seems to fix it, it's time to take a closer look. With pancreatic cancer, one of the early warning signs can be persistent nausea, vomiting, or general digestive discomfort, even when you're eating mild or bland foods. You might feel sick after meals, lose your appetite, or notice that certain foods suddenly upset your stomach when they never did before. Some people describe it as a constant queasiness or heaviness in the gut that doesn't go away. Here's why it happens. The pancreas helps your body digest food by producing enzymes. When a tumor blocks the pancreatic duct, those enzymes can't reach your small intestine. That means your food, especially fatty or protein-rich meals, doesn't get digested properly. As a result, it sits in the stomach too long, causing bloating, gas, nausea, and even vomiting. And remember those greasy, foul-smelling stools we talked about earlier? You might notice those at the same time as these digestive issues. It's all connected. When your body can't break down and absorb nutrients, it reacts, and not in a pleasant way. The biggest challenge: these symptoms are incredibly easy to mistake for acid reflux, indigestion, or food sensitivity. Many people try antacids, probiotics, or even eliminate certain foods, thinking it's something minor. But when the problem keeps coming back, or gets worse over time, that's your signal to dig deeper. If you've been battling ongoing nausea, stomach discomfort, or changes in digestion that don't go away with dietary changes, ask your doctor about your pancreas. A simple enzyme test or abdominal scan could help rule out something more serious, or catch it early when treatment is still possible. Don't settle for, "It's just aging," or "probably something I ate." Chronic digestive issues might be your body's way of alerting you to a bigger issue, and the sooner you listen, the better your chances for early diagnosis and treatment. Let's be clear, even just 2 or 3 of these symptoms showing up together is a strong reason to get checked. Don't assume it's nothing. Don't wait until things get worse. With pancreatic cancer, early detection can save your life, but only if you act before it's too late. If anything in this video felt familiar or concerning, talk to your doctor and request the right tests. It's always better to be safe than sorry. And if you found this video helpful, please take a second to like, subscribe, and share it with someone you care about. You never know who might need this information right now. Your health, and your voice, could help save a life.